Hello everyone. Today we are continuing our ophthalmology series, and I am going to tell you about the most important topic and certain nuances which I will cover today. So now we are going to see about Ophthalmia Neonatorum. Even though the name looks really fancy like Ophthalmia Neonatorum, what does this mean? You need to know that Ophthalmia Neonatorum means neonatal conjunctivitis. So you have to neonatal conjunctivitis. You have to translate in your mind that whenever you hear Ophthalmia Neonatorum or see in the question vignette, they are talking about neonatal conjunctivitis. Now secondly, what are the causes of Ophthalmia Neonatorum or neonatal conjunctivitis? The two most important causes are, first one is the Chlamydia and the second one is the Gonococci. What is the difference and how will the vignette be and which one are you supposed to select? The first difference is the onset. Chlamydia trachomatis is because of the D2K strain is the one which causes neonatal conjunctivitis, but the onset is, it will always occur more than 1 week post birth. So within the first week, if there is an infection in the neonate and if we diagnose it as neonatal conjunctivitis, then it is mostly due to Gonococci, where it is within the 1 week. This is the first most important. The second most important finding is that both the Chlamydia as well as Gonococci will be presenting with yellowish discharge from the eye. But what is the key feature? The key feature is that in Chlamydia trachomatis, it can drain through the nasolacrimal duct to the lungs and it can be associated with pneumonia. So almost always when they want you to know that the organism is Chlamydia, then they will be giving you features with pneumonia. This is the second clinical feature. This is the second difference. Now, how will the cells be in Chlamydia trachomatis? Chlamydia as such is an obligate intracellular organism. So, any intracellular organism, it is going to behave like a virus. So, therefore, there will be lymphocytic shift. In Chlamydia trachomatis. Why? This is because the organism per se is obligate intracellular. Now here comes the next most. Now you can differentiate whether it is Chlamydia or Gonococci with these two main symptoms, like what is the onset and whether it is associated with pneumonia. The second most important thing is, what about the treatment? The treatment for Chlamydia is either we have to treat the mother, but if it has occurred in the neonate, then it has to be treated with oral erythromycin. Why? This is because the Chlamydia trachomatis is almost always associated with pneumonia. So therefore, for better treatment, we need to give them only oral. Topical alone will not be of help. It is no use in treating only the eye, because now it has spread to the lungs too, resulting in pneumonia. So therefore, the treatment is oral erythromycin. But on the other hand, for Gonococci, since it is mostly localized to the eye, so the prophylaxis is topical erythromycin. And if you are going to treat the patient, then IM ceftriaxone has to be treated, or cefotaxime can be treated. So the most preferred is the IM cefotaxime and not ceftriaxone is the preferred one. So this is in brief about neonatal conjunctivitis. Now how will the vignette be? After knowing all this, you should be able to answer this. They will be giving you like a vignette, neonate who is presenting with wheeze, crackles and fever and is treated for Chlamydia conjunctivitis with topical erythromycin. Now as I said before, what is the treatment for Chlamydia conjunctivitis? It is oral erythromycin, right? So in that case, what should be the treatment? The treatment should have been oral erythromycin, and topical erythromycin is not the treatment for the for that case scenario. So this is what in brief about Ophthalmia Neonatorum. All the best for your exam.